I will be talking today about the treatment of problem behavior using functional communication training. Functional communication training is one of a number of function-based treatments. Function-based treatments are ones that try to understand and treat problem behavior in its environmental context. And to explain that, I have a little story I like to tell. There was a man walking in the woods, and he came upon this object, picked it up, started rubbing it, and it turned out to be a bottle, and a genie pops out of the bottle and says, "I've been stuck in that bottle for 3,000 years, and for your reward for releasing me, I will grant you any 3 requests you want." So the guy thought long and hard, and he said, "Well, you know, my health's been kind of bad. My heart's bad, my knees are bad, I feel pain all the time, I can't seem to get up enough energy to do things. It'd be kind of nice to feel good for a change." And the genie goes, "Poof, your wish is granted. What's your second wish?" And the man thought long and hard again, and he said, "Well, you know, I've always been really poor, never had any money, never been able to do things, never been able to travel or buy things I wanted. It'd be nice to have a little bit of money." And the genie goes, "Poof, your second wish is granted. What's your third wish?" And now the guy was down to 1 wish, and he really thought for a long time, and he finally said, "Well, you know, it'd be really nice if my sex life would improve." And so the genie goes, "Poof, your third wish is granted." And about a month later, 2 months later, the guy's walking through the woods again, and he happens upon the genie. And the genie says, "Oh, well, how did the wishes go?" He says, "Oh, great, I've just been to see the doctor, and he's given me a clean bill of health. I'm pain-free, I'm running, I'm jogging, doing all sorts of things. I never felt better in my life." The genie says, "What about the second wish?" "Well, apparently, I had this rich, distant relative, and I was his only heir, and he's left me all the money I'll ever want or need, and so now I can buy things, travel, do whatever I want." The genie says, "Well, what about the third wish?" He says, "That's the best one of all. I'm having sex every other week or so." And the genie kind of scratches his head and said, "Sex every other week? And no, my wishes usually come out a little bit better than that." And the man said, "Well, it's not bad for a priest in a small town." So the point is that we have to think about and understand behavior in its context, and functional analysis and function-based treatments help us do that. And so that's what I'll be talking about today. So functional communication training is used to treat a wide variety of problem behaviors, such as aggression, self-injurious behavior, inappropriate vocalizations. And it is prescribed on the basis of a functional analysis. And once we understand the function of problem behavior, then we're able to put problem behavior on extinction or see that it no longer produces reinforcement. And then we're also able to use that reinforcer to train up a functional communication response. And so we allow the individual to access that reinforcer through appropriate behavior rather than through problem behavior. And so what you see on the slide here is some of the potential components of function-based interventions. And one of the things that we can do is to provide the functional reinforcer for appropriate alternative behavior, and we do that with functional communication training. We can also provide a competing reinforcer, a reinforcer that is highly valued by the individual that they may prefer over the reinforcer for problem behavior. We may remove motivation or the establishing operation for problem behavior so that the individual is less likely to engage in problem behavior. And we may remove the reinforcement contingency for problem behavior, again, place the behavior on extinction, which is one of the components we do with functional communication training. And then finally, we may remove the functional reinforcer contingent on problem behavior. So rather than, as in the past, problem behavior produced the reinforcer, problem behavior actually decreases access to that reinforcer. So with functional communication training, the individual is taught a communicative response that produces access to the reinforcer responsible for maintenance of problem behavior. For example, an individual whose problem behavior is maintained by escape from non-preferred tasks might be taught to request a break from tasks using an appropriate communication response, such as asking for a break, break please, or signing finish if they don't speak. And this functional approach to treating problem behavior is different from a more traditional diagnostic and prescriptive approach. So most structural approaches involve looking at a number of behaviors, what they look like, and whether or not they co-vary. So for example, if a child has significant limitations in communication and social relatedness and has repetitive activities, interests, and behaviors, that might lead to the diagnosis of autism. But simply making the diagnosis of autism doesn't tell us very much about where we should start to intervene. It perhaps provides some broad areas that we need to target, but doesn't pinpoint how we're going to go about intervening with a particular child. We contrast that with a functional approach, where a functional approach is looking at one or a small number of responses at a time, and we're trying to understand the environmental context in which that behavior occurs, and that helps us to pinpoint what we need to do in terms of intervening and developing a specific treatment. So what does a functional analysis do? Well, it identifies the environmental context in which aberrant behavior is likely to occur, when it's likely to be high, and also those situations in where it's likely to be low or at zero levels. It helps us to identify the antecedents and consequences that occasion, evoke, and reinforce or maintain problem behavior, and a functional analysis is used to prescribe effective treatments. Some of the common functions of problem behavior, such as self-injurious behavior, involve social positive reinforcement, where the behavior produces attention from adults or produces access to preferred items or toys. And if that occurs a lot, the individual may learn to display problem behavior in order to get access to those things. Another common function is what we call social negative reinforcement or escape, where an individual may be asked to do a non-preferred task, such as folding towels. And with most of the individuals we work with, we don't teach them a task simply by standing up lecturing like I'm doing right now. We literally may get behind them and take their hands and say, this is how you fold the towel. And for some individuals, they may not like this situation, may do something inappropriate, knock the materials off the table, try to hit or bite the therapist, or even hit or bite themselves. And the natural reaction of a parent or teacher in that situation is to back off and give the child a chance to calm down. Well, if that happens over and over again, what the child may learn is, if I want these tasks to go away, these people to leave me alone, the thing to do is to hit yourself. Now, most of the individuals that we work with don't think through and plan this like I just explained it. But if they experience that contingency over and over again, they may learn the association and learn to escape non-preferred tasks through problem or inappropriate behavior. And a final function that we typically look at is automatic reinforcement. And the example I like to give about this is just about all of us, if we have discomfort and we have an itch, we scratch it and it feels better. That would be an indication where it isn't the reaction of any other person, it is that the reinforcer is the automatic product of the behavior. And what we see very frequently is individuals who display problem behavior in order to produce sensory stimulation. So for example, individuals who have very limited visual acuity, who maybe not be totally blind, but are blind or close to blind, but have intact neural pathways, we see lots of self-injurious behavior directed toward the eye. And why is that? Well, just about anybody, if you press or push on your eye, you'll produce stimulation in the occipital lobes. And for someone who's deprived of sensory stimulation all day long, that limited form of sensory stimulation may be enough to direct their self-injurious behavior toward the eyes. And that would be an example of automatic reinforcement. So how do we assess the function of problem behavior? Well, there are a variety of methods. Probably the most efficient and easy to use are called indirect assessments, and these consist of questionnaires or rating scales. They tend to be easy to use, but they also tend to have the greatest problems in terms of reliability and validity. Nevertheless, with some mild cases and some more obvious cases, they can be used and quickly lead to intervention. The next level of a functional assessment is called direct observation assessment, or sometimes called a direct or a descriptive analysis. And this involves going and having systematic observations in the child's environment and looking for correlations between certain antecedents in the behavior and between the behavior and certain consequences. And if we see a high correlation, that may suggest that that is the function of problem behavior. So if in the natural environment we see that very frequently self-injurious behavior is followed by attention, that would suggest that perhaps attention is the reinforcing consequence. The one limitation of this methodology is that it tends to produce a fair number of false positives, where we find a correlation, but that correlation isn't actually responsible for increases in problem behavior. And then the final a set of procedures are called functional analysis. And functional analysis has two major characteristics. One is that we're going to use direct, reliable observation measures to quantify and measure the behavior. And then the second thing is that we're going to systematically manipulate the variables that we're hypothesizing to be the function of problem behavior. So if we're trying to assess whether the behavior is maintained by attention, in certain conditions we're going to deliver attention following problem behavior. And then in other conditions we're going to deliver attention pretty much all the time, but not systematically following behavior, to see whether it increases in that situation where it produces attention and is much lower in the situation where attention is delivered freely. And so this is the methodology that we use mostly for individuals with more severe types of problem behavior. And there's a fair amount of research on the effectiveness of these procedures for identifying the function of problem behavior, and also for prescribing highly effective interventions. And there's ongoing research to work on making these procedures as efficient as possible, and significant progress is being made in that area, such that the major limitation of functional analysis in the past has been how highly trained individuals have to be to carry out the procedures, and then how long it takes. And we're working on both of those things and making significant progress. And so this is an example of a graph from a functional analysis, and what you see is a series of data points, and each data point represents approximately a 5-minute sample of behavior in which we're testing each of the major hypotheses, whether the behavior is maintained by attention, whether it's maintained by escape from demands, whether it's maintained by automatic reinforcement, or maintained by tangible reinforcement. And you can see in this graph that most of the problem behavior is occurring in the attention condition, indicating that this is a form of problem behavior maintained by contingent attention. And this is just an example of a typical treatment graph. We'll start out in baseline, and what you see in this baseline phase is destructive behaviors occurring at roughly 4 to 5 times per minute. We then introduce the functional communication treatment and extinction of problem behavior, and we have high rates of communication and near zero rates of destructive behavior. We go back to baseline to help show that it is our treatment that's responsible for the reduction in problem behavior, and we see that destructive behavior increases again. And when we reinstitute functional communication plus extinction, clearly we see high rates of communication and, again, near zero rates of destructive behavior. And this is really our starting point in terms of finding something that's going to work. And then our next important components is we want to make the treatment practical and feasible, such that a parent can implement the treatment in the home, or a teacher can implement the treatment in the classroom or other natural environments. So functional communication training has been used with a fairly wide variety of topographies of problem behavior and also diagnoses. Response topographies treated using FCT include aggression, self-injurious behavior, property destruction, other forms of disruption in the environment, elopement, inappropriate sexual behavior, and inappropriate vocalizations. And this treatment has been used with a variety of diagnoses, including autism, intellectual disability, attention deficit hyperactivity disorder, traumatic brain injury, and speech and language disorder. And when trying to decide when FCT is appropriate, it's important not only to think about the type of behavior, its topography, but also the function of problem behavior. So FCT is probably appropriate for most forms of problem behavior, at least outward forms of behavior that we can measure. But it is most appropriate for behavior where the function is maintained by social consequences. So behavior maintained by attention, escape from demands, tangible items, it's very appropriate. For other functions, such as automatic functions, it is less so. And it's also important to distinguish topography from function. So it's possible to have two topographies of self-injurious behavior, and both of them might have the same function, both maintained by, say, escape from demands. And in that situation, then one form of FCT would be appropriate for treating both of those topographies. However, it's also possible that you have two topographies of self-injurious behavior that have separate functions, say one maintained by attention, another maintained by escape. And in using FCT, we would then have to address each of those functions and have a form of FCT designed for attention maintained behavior and another for escape maintained behavior. So what are those appropriate functions? Well, as I said, FCT is most appropriate for problem behavior reinforced by social consequences such as attention, escape, and tangible reinforcement. Now, FCT has occasionally been used successfully with responses maintained by automatic reinforcement, but it is often difficult to manipulate automatic consequences. So if a behavior is maintained by sensory stimulation, such as headbanging producing kinesthetic sensation, sometimes we can apply a helmet or put them in situations that mitigate that sensory consequence, but it's often difficult to eliminate it totally. We can also do things like response blocking to prevent the response from occurring. So it's difficult to implement extinction of automatically reinforced problem behavior, but it's equally or sometimes more difficult to then provide a similar or the exact type of sensory stimulation with an FCT, following an FCT response, because other people typically don't control the reinforcers that are delivered automatically from, as a response product of problem behavior. So other assessments that may be needed as adjuncts to functional communication. Well, one thing is it's very important to do a risk assessment before beginning a functional assessment. Also, medical assessments may be needed to identify co-occurring behavioral health disorders that may affect treatment. Example would be major depression. Medical assessments may also be needed to identify associated medical conditions, such as earaches, headaches, detached retinas that may occur from head banging, or concussions that may occur from head banging. And so we want to make sure that those things are addressed as well. And also in such cases where the behavior is dangerous, we want to have medical input into our risk assessments. So what do we typically do with most cases for a risk assessment prior to a functional analysis? It's important to interview caregivers to determine how often and under what conditions problem behavior has resulted in physical harm to self, others, or the environment. And that, asking about, has anybody ever gone to the hospital as a result of this behavior? Have they caused tissue damage? Have they caused cuts, bruising, any concussions? We also want to know whether or not the individual engages in self-injury or aggression towards delicate body parts. Okay, so individuals that may engage in eye gouging. And those types of behaviors, even when we're doing the functional analysis, we want to either have protective equipment that's going to eliminate that dangerous topography, or we want to block those topographies and conduct the functional analysis focused on other less severe forms of self-injurious or other behavior. For some individuals, a padded treatment room or protective equipment may be needed as a part of the functional analysis. And it's real important to have very clear criterion for terminating sessions. So we typically start out with if either the individual is harming one of our staff, putting them in danger. If the individual is engaging in self-injurious behavior that's producing reddening of the skin or bleeding, we're going to stop sessions at that point and problem solve on how we can come up with a safer way to get the same information on the function of problem behavior. Now, another important thing to determine is whether or not functional communication training is the most appropriate operant intervention or treatment. As we've said, functional communication training involves the delivery of the functional reinforcer contingent on a communication response. The most common alternative approach would be non-contingent reinforcement, or NCR, which involves the delivery of the functional reinforcer on a time-based schedule. So very regularly, the reinforcer that previously reinforced destructive behavior or problem behavior, we're going to deliver on a time-based schedule so that they're getting that reinforcer a lot and shouldn't be motivated to engage in behavior in order to get it. And also, we might use competing reinforcers that can be delivered either on a contingent basis, such as based on a communication response, or delivered on a time-based schedule like NCR. So what do we do to determine whether FCT is the appropriate reinforcement component versus non-contingent reinforcement? Well, one question that's important to ask, is it possible to manipulate the reinforcer for problem behavior? And so I already gave the example of individuals with automatically maintained behavior. It's often very difficult to do that. And typically, we would not use functional communication training in that situation. We would use non-contingent delivery of competing reinforcers as our first starting point. A second important question to ask is, are there many times when it is impractical to deliver the functional reinforcers? So if you have a family that is very chaotic, a parent has multiple children, and the behavior is maintained by attention, it is going to be very difficult to expect that parent to deliver the reinforcer on a dense reinforcement schedule, and FCT may not be the most practical treatment in that situation. A third important question is, how dangerous is the behavior? And so really dangerous self-injurious behavior or really dangerous aggression, typically we may have to use other procedures, at least initially, and then perhaps add a functional communication response later in the treatment process. So why would that be? Well, one of the things when we start treating problem behavior is that we're expecting them to emit the functional communication response. And many of the individuals that we work with don't do that automatically. We can't just tell them, do this instead of your problem behavior, and you'll get the reinforcer. Some kids we can, many we can't. And so we have to prompt them to do the functional communication response, and they have to learn it and use it in place of this behavior that's had a long history of reinforcement. And in that situation, we may prompt them, try to get them to do the functional communication response. They may not do it, and while that's not occurring, they're being exposed to the motivational or establishing conditions that are likely to evoke problem behavior. And if the behavior is real dangerous, we don't want them engaging in that. And so an approach like non-contingent reinforcement, where we can deliver the reinforcer frequently and reduce motivation for the behavior, that may help prevent extinction bursts that are likely to occur early in the treatment. We also have some procedures that I'll be talking about later to help mitigate that problem with functional communication training, so that it can be used more often in those situations. And then finally we ask, is teaching a communication response an important goal independent of problem behavior? So many of the individuals that we've worked with come to us with very, very limited and sometimes no vocal or no non-vocal MAD repertoires. They don't sign, they don't point, they don't tell us what they want, and so they don't have a repertoire with which to request reinforcement. They primarily use their problem behavior. And so for those individuals, it may take a little bit longer to reduce problem behavior using functional communication training, but it may be very important to start to establish that communication response in terms of the long-term effectiveness of the intervention. And so simply presenting the reinforcer non-contingently may reduce the behavior immediately, but over the long term, establishing that communication response is likely to have a sustaining effect on reducing problem behavior. Okay, so some of the unique features of functional communication training. Well, it is a DRA procedure, or differential reinforcement of an alternative response. And it is unique in that it specifies its reinforcer. That is, the functional communication response is a manned specifying the reinforcer that previously reinforced problem behavior. We want it to require minimal effort. We want it to make it very, very easy for the individual to do the response. And at least initially, we want to reinforce it on a very dense schedule, usually an FR1. That is, it works like magic. Every time the individual emits the functional communication response, we want to deliver the reinforcer. And hopefully, once taught, the response is something that's recognized by a wide variety of people so that the individual can recruit reinforcement across a variety of individuals and environmental contexts. Now, because of the ease and consistency with which reinforcement can be obtained during functional communication training, some authors have suggested that the client controls the delivery of reinforcement. In addition, Carr and Duran have suggested that control over reinforcement may contribute to the effectiveness of FCT. We've done one, and others have done another investigation, and found that non-contingent reinforcement, which clearly the individual does not control the schedule of reinforcement, it's based on time, and FCT, which does, produce equivalent reductions in problem behavior. So both treatments work about the same, at least when they're initially introduced. Nevertheless, what we found was that participants preferred FCT over NCR when given a choice. You can have this treatment or that treatment. And so given that having individuals, especially those with limited communication, giving them multiple choices is an important goal in and of itself, FCT probably is the preferred intervention in most cases. Okay, so what else? Well, as we said, functional communication training may promote generalization and maintenance because the communication response may prompt both trained and untrained caregivers to deliver the reinforcer at appropriate times and for appropriate behavior. Now, there are also a number of limitations of functional communication training, and that's been the focus of our research here for some time. How do we deal with these limitations? So one limitation is that teaching the functional communication response may evoke problem behavior. And this is particularly true if the behavior is maintained by escape from non-preferred tasks, because when we ask or place the demand on the child to emit the functional communication response, that's one more demand we're placing on them, and that demand itself may evoke problem behavior. A second limitation is that individuals may display the functional communication response at exceedingly high rates, requesting a break from every single school task, requesting constant attention from an adult, requesting to be the only one that plays with the family computer or iPad. And so that obviously can be very problematic. And finally, individuals may request reinforcement at times when it is impossible or inconvenient for the caregiver to deliver. So if a caregiver is attending to a sick sibling or an infant sibling, it's going to be very difficult for them to deliver attention to the target child when that target child displays the appropriate communication response. And so we want to develop treatments in which the functional communication response produces reinforcement at certain times, but the individual learns to tolerate periods when that reinforcer is unavailable, and we want them to do that in such a way that that problem behavior does not come back. So how do we select the most appropriate communication response? Well, as I said previously, one important factor is the communication response should be very simple for the individual to do. And the communication response should produce the reinforcer identified during the functional analysis. When we first start FCT, the communication response should always produce that reinforcer. And if the child cannot do the response independently, we help them so that they can do it quickly and then deliver the reinforcer. And this is one way that we've developed to try and limit exposure to the motivational conditions or the establishing operation so that extinction bursts are less likely. The communication response should match the function of the child's problem behavior. So for example, if the child's behavior is maintained by escape from demands, we may teach them to say, break please. If it's maintained by attention, we may teach them to say, play with me please. If it's maintained by a tangible reinforcer, we may teach them to say something like toy please or iPad please. And then for those children who do not speak, we often use a picture exchange or card touch. Well, all they have to do is touch a card, and the card may, if it's attention maintained behavior, the picture may show the child playing with an adult. For escape from demands, they may just touch a card that shows them leaving the work area. For tangible reinforcement, may have them touch or hand over a card that shows them playing with their favorite toy.
Give it to me. Good job touching the card. Give it to me. Good job touching the card. Give it to me. Good job touching the card. Give it to me. Nice job touching the card, Katie. My turn. Nice work touching the card. My turn to play. Good job touching the card, Katie. My turn to play. Nice work touching the card. My turn to play. Good job touching the card. My turn to play. Good job touching the card. My turn. Nice work touching the card. My turn. Good job touching the card, Katie. My turn to play. That's touching the card. My turn. Good touching the card, Katie.
Okay, it's also important to note that when we do functional communication training, we typically combine it with extinction of problem behavior. And it's important to distinguish between different functions of problem behavior because extinction looks different based on the function of problem behavior. So if the behavior is previously reinforced by attention, then extinction would involve no longer delivering attention following the target behavior. If the behavior was maintained by tangible reinforcement, then extinction would involve no longer delivering that tangible item following the target behavior. Those two are pretty simple, but when we think about escape extinction, it gets more complicated. And so when a behavior is maintained by escape from demands, what we want to do is continue with demands as if the behavior never occurred. And for some individuals, this can be highly difficult. So they may do things like throw the materials off the table. If you don't have another set of materials to quickly go on with the next prompt in the sequence, then while you're picking up the materials, they're getting a break from the tasks. And we want to prevent all those potential forms of integrity errors that may allow the individual to access the reinforcer that we want to prevent them from accessing in order to implement extinction correctly. And finally, for behavior maintained by automatic reinforcement, we want to see if there's a way to either mitigate or prevent the sensory consequences of the response. And again, that may be putting on padding or protective equipment, or it may involve response blocking in order to prevent the sensory consequences of the behavior. So how do we address these limitations of functional communication training? Well, that's what I'm going to talk about next. And one is we want to see if we can arrange our stimulus conditions in ways that prevent extinction bursts. And this is especially important during the initial training of the FCR, or the functional communication response. And also a very important part is we want to bring the functional communication response under what we call discriminative control, so that we can signal when reinforcement is available for that response and when it's not. And what we want to teach individuals is to request reinforcement when we signal that it's available. And when we signal that it's not available, we want to teach the child that during those times, they need to tolerate a period where they can't access the reinforcer. And we want them to, when we talk about teaching them to tolerate that, what tolerance means is we want them to be able to not engage in the functional communication response. That is, not nag the parent, yes, I want the iPad, I want the iPad, I want the iPad. And we also don't want the functional communication response to decrease and be replaced by a resurgence of problem behavior. So some of the things that people have done in terms of teaching tolerance for delays or periods where the reinforcer is not available involve signaled and unsignaled delayed reinforcement. And the research is kind of mixed on the effectiveness of that, but in most cases, signal delays are going to work better than unsignaled, but one of the problems that we've noted with delayed reinforcement is over time, and as you make larger and larger delays, the response tends to weaken, and so you lose, the individual stops emitting the functional communication response. A second procedure involves presenting activities or alternative reinforcers during the reinforcement delays. And what do we mean by that? So if we have a behavior maintained by adult attention, and the adult, say mom's going to make lunch, providing the child with a highly preferred toy, say the iPad or watching a favorite movie, during that time may decrease motivation because the child isn't going to engage with this alternative reinforcer rather than engage in attention-maintained problem behavior. And then finally, the place where we've done the most research is in using what we call multiple or chain schedules, where we alternate periods where the functional communication response produces reinforcement and periods where it doesn't, where the functional communication response is on extinction. So what are the steps involved in developing a multiple or chain schedule? Well, the first thing is we bring the functional communication response under the control of discriminative stimuli that signal periods in which the functional communication response will and will not produce reinforcement. And so that would be a multiple schedule with periods where the response is reinforced on a FR1. Each time the behavior occurs, it produces reinforcement, and we signal that. And then we have another signal that says, no matter what you do right now, you have to tolerate this period where the reinforcer is not available. And then typically we want to gradually lengthen the duration of the extinction component of the multiple schedule until the level of reinforcement delivery is practical for the home and a classroom setting. So very frequently we end up with a schedule where the reinforcement component lasts 1 minute and the extinction component lasts 2 minutes, and those are alternated in a quasi-random fashion such that the individual is experiencing some periods where the extinction components last a total of 4 minutes, or there's 2 back-to-back 4-minute components and they have to tolerate the unavailability of the reinforcer for an 8-minute period. In one of the first studies that we did to look at this, we delivered reinforcement for the functional communication response on an FR1 schedule in the presence of a discriminative stimulus. In this case, we just had a big picture card on the wall showing the child consuming the reinforcer. And when that card was up and visible, reinforcement was available for the communication response. And when we took that card down and put it out of view, then reinforcement was unavailable. And we alternated these periods. Each period lasted 30 seconds with the card up and 30 seconds with the card down. And this decreased the rate of the functional communication response, the number of times the individual was requesting reinforcement, by 50%, but it was still very labor intensive and not very practical. In this graph, it just shows an example from that study. You see in baseline destructive behavior in the top panel is occurring at about 5 times a minute. We then introduced functional communication training and also had one where we used a competing or alternative reinforcer, in this case toys. We go back to baseline, you see high rates again of problem behavior, and then back to treatment, and low rates in both treatment conditions. And then in the bottom panel, we show what happens with the communication response. So the squares, both the open squares are for the functional communication training, the closed squares are for the alternative communication training. What you see is the individual very quickly learns to request reinforcement when it's available and not request it when it's unavailable. All the circles represent the times when we're signaling that the reinforcement is unavailable. So the individual is learning to request reinforcement when we signal it's available and to withhold or not request reinforcement when we signal that it is unavailable. So the next important study in developing the effectiveness of multiple schedules for teaching individuals to tolerate periods where reinforcement is not going to be available in order to make FCT more practical was a study by Hanley et al. in 2001. And what they did was to quasi-randomly alternate between the FR1 schedule and the extinction component, just as we did. And each component was correlated with a specific signal. But initially, the duration of the reinforcement component was 3 to 4 times longer than the extinction component. So very dense reinforcement initially, and then gradually they decreased the reinforcement component and increased the extinction component until the extinction component was again 4 minutes, which produced periods sometimes 4 minutes, sometimes 8 minutes, where the individual had to tolerate the absence of the availability of reinforcement, and then periods of 1 to 2 minutes where reinforcement was available. And this graph just shows the progression that they went through from very dense reinforcement at the top to the final schedule where they're alternating 60 seconds of reinforcement available with 240 seconds where the reinforcer is unavailable. And this decreases the number of times the individual requests reinforcement by about 75 to 80%.
My turn to play. Good touching the card. My turn. Good touching the card, Katie. My turn to play. Nice work touching the card. My turn to play. Good waiting, and nice job touching the card. My turn to play. Awesome job touching the card, Katie. My turn to play. Good waiting. Good job touching the card. I'm gonna play now. Nice touching the card, Katie. My turn. Good waiting. Awesome job touching the card. My turn. Good waiting. Nice work touching the card, Katie. My turn to play with the iPad. Touch nicely. You need to touch the card nicely. Touch the card nicely, like that. That's touching the card nicely. My turn to play. Touch the card nicely. Touch the card nicely, like this. You do it. Good touching the card nicely. My turn. Good touching the card nicely, Katie. Good waiting. Nice work touching the card. Good job waiting. Nice touching the card, Katie. Nice touching the card. Good waiting. Nice job touching the card. Good waiting. And awesome job touching the card. Nice work waiting, Katie, and good job touching the card. Great waiting, Katie, and good touching the card. Awesome job waiting, Katie. Nice touching the card.
So in that video, you saw someone who picked up the multiple schedule fairly quickly and learned to request reinforcement when it's available and not when it's unavailable. Not all patients or participants learn the response so quickly. And so some of the things that we run into is the individual may take the card and tear it up. The individual may continue to request reinforcement very frequently, both when we signal that it's available and when it's not available. So in the first situation where we have somebody doing something inappropriate, we may do something very simple, like during the initial training, we will tape down the picture card to the table so they don't have that opportunity to pick it up, throw it, tear it up, or throw it under the door so it's no longer in the room. And that also makes it easier for us to prompt the response because it's always in one place. We will do that initially, and once the individual starts to learn that touching this card is a good thing, it produces a preferred reinforcer, typically the problem behaviors tend to drop off, and then we can start asking them to do more complex responses, and that may involve handing over the card. If they're starting to get some language, we may see where they have to emit a vocal response, say please, and so that we're gradually trying to increase the complexity of the response and build up their communication repertoire. But often we want to start with that simple response so that we can control access to the establishing operation and decrease the probability that there's going to be an extinction burst. What if we have somebody that is requesting reinforcement frequently, both when we signal it's available and unavailable? Typically what we'll do in that situation is replace the multiple schedule that we're currently using with one that we call response restriction. And what does that mean? Well, if we have a picture card and we put it out, the individual can touch it and access reinforcement during the reinforcement component, and then we take that card and put it away when reinforcement is unavailable. So the card both makes the response available, but also signals that reinforcement is available. So it acts both as a response card and as a discriminative stimulus. And in doing that way, we can they obviously, when we put the card away, they can't touch it, so they can't request reinforcement when it's unavailable. If someone has a vocal response, they may continue to request reinforcement when it's unavailable. We will sometimes use the card in combination with the vocal response where they have to both, kind of like handing over a token. You can say, toy please, but you also have to have the card and hand it over. And typically both, they can't when we put the card away, they can't hand that over. They quickly learn that it doesn't do any good to nag and request vocally when you don't have the card, because it's very, very salient that you only get reinforced when you have both the card and you say toy please. Okay, so what are some of the things that we've done to mitigate, other things we've done to mitigate these limitations? And one of the things is that we think it's really important to control the establishing operation for problem behavior during the early stages of treatment. And by doing this, we think that it produces more rapid reductions in problem behavior and also prevents extinction bursts. And how we got started on this, treatment variation in line of research was that we had a young boy with autism who came to us with severe head banging. And we started assessing and treating his head banging, and his orthopedic surgeon said that he had a problem with his vertebrae such that banging his head could result in paralysis. And the orthopedic surgeon basically said, you guys got to stop him from, he can never bang his head again. And we weren't, it's obviously not possible to prevent it altogether, but we really made an effort to say, how can we really treat this individual but really decrease the probability that he's going to have an extinction burst or have very low rates of problem behavior when we initiate treatment. And so he was somebody that would walk around the room, jump up and down, bang on the walls, occasionally go up to a therapist and approach them, and we quickly found out that that was kind of a man for being picked up and tossed around a little bit. And so his behavior was maintained by escape from demands, and so we would allow him to do this walking around. When he approached a therapist, we'd flip him up the air, and at the end of this little reinforcement interval, we'd put him in the work table, guide him to touch the picture card for escape, and then got him out of the work context almost immediately. So he was exposed to what we'd call the establishing operation, that being at the work table where the behavior is likely to occur, for a very brief second or two. And we did that many, many times, and then started to fade, so he had to touch a card independently, and then started to fade in toys and preferred materials so that if he didn't touch the card right away but started interacting with the materials, we didn't guide him, we didn't prompt him to touch the card, we allowed him to interact with those materials and stay at the work table until he stopped interacting with them, and then we'd prompt him to touch the card and then get him out of there. And then we gradually started fading in demands, and after a very long treatment protocol, because again we wanted to err on the side of being cautious, we were able to reduce his self-injurious behavior, get him working for 15 minutes at a time at the work table, doing regular discrete trial type of instruction, with very, very rarely did he attempt or display self-injurious behavior. Okay, so we've now, because of this one case, really tried to study that and what are the important variables in that situation. And so a study that we have coming out in JABA, we compared two conditions. One in which we had the FCT response be a card touch, where we knew we could guide it and guide it very quickly and limit exposure to the establishing operation. And we compared that with a vocal response, where we prompted the individual to say something like, "Break, please," where sometimes they'd say that right away, get out of the task and not be exposed to the establishing operation for a long period of time. But at other times, we'd prompt them to say, "Break, please." They wouldn't say it. We continued on with the demands. And basically what we found in that condition where we couldn't control how much exposure they had to the establishing operation, they tended to have higher rates of problem behaviors, and in some cases even extinction bursts. And so that basic procedure of picking a response where we know we can control the establishing operation, we make sure that the response occurs by prompting them physically to touch the card and then getting them out of the demand or whatever the EO context is, that is going to help prevent extinction bursts. And so in this treatment, in this study, we had baseline, and then following baseline, we had the two FCT treatments, one with a card touch as a response, one with a vocal response. And we introduced both of those treatments with a progressive time delay to teach the functional communication response. And then we compared it in a multi-element phase. And then following a return to baseline, we then implemented the most effective treatment as the ongoing treatment. And this is just a case example from that study. What you see in baseline is destructive behavior occurring at about 2 per minute. We introduce the 2 treatments, and almost immediately problem behavior is decreased to near 0 levels in the card touch condition, and we see a very large extinction burst in the vocal condition where we couldn't control the establishing operation. We go back to baseline and get high rates again, and then back to treatment with just the card touch, our final treatment, and again produce near 0 rates of destructive behavior very rapidly. And this just shows the effects on the child learning the communication response. And what you see is when we introduce from the 0-second prompt delay to just a very brief delay, the individual immediately begins independently touching the card, and the acquisition of the vocal response was much more gradual. And so in this study, we found that the FCT card condition allowed better control of the establishing operation for problem behavior. The FCT card condition produced more rapid reductions in problem behavior, and the FCT vocal condition was associated with an extinction burst for one participant, which was not observed in the FCT card condition. So that's on the front end of functional communication training, and in that situation, that's where we believe it's very important to control the establishing operation. And then later on in treatment is where we think it's really important to bring the functional communication response under tight discriminative control using either a multiple or a chain schedule. And we think this is particularly important for increasing the practicality and generality of functional communication training. And part of our work is based on behavioral momentum theory. And behavioral momentum theory is a quantitative theory that employs a comparative metaphor based on the classical mechanics of the momentum of physical objects. And behavioral momentum theory is relevant to FCT because it provides quantitative models and predictions about the persistence and resurgence of problem behavior when the FCT response produces reinforcement and when it doesn't. So it helps to tell us when we introduce these periods where we're asking the individual to tolerate periods where reinforcement is unavailable. In behavioral momentum terms, that's an extinction challenge. And this behavioral momentum theory helps us to predict what's going to happen when we do that. And so we're using this theory to help us better refine functional communication training. And the momentum metaphor to the momentum of moving objects, where object's persistence or its momentum is the result of its mass times velocity. And then we have a parallel one for behavioral momentum, where the momentum of a response involves the rate of reinforcement times its response rate. And in this metaphor, the mass of a moving object is equivalent to the rate of reinforcement of a response, and its velocity, the velocity of a moving object, is equivalent to the response rate in a behavioral momentum paradigm. And this video shows us an example of the momentum of a moving object. We have 2 balls, the white ball, which is lighter, and the red ball, which is heavier. They're actually not that much heavier, but we have a little bit of acting going on to show the effects. And what's going to happen is our therapist is going to throw each of these balls and see how the mass of those objects affects their momentum. One of the things that we've learned from prior research on behavioral momentum is that reinforcing an alternative response with the functional reinforcer in the same stimulus context in which problem behavior was previously reinforced bolsters the momentum of both responses. Let me say that again. By reinforcing the functional communication response and doing that in the context in which destructive behavior previously produced that reinforcer, that reinforcing the alternative response, although it decreases the rate of problem behavior while that reinforcer is available, if we then introduce an extinction challenge, such as we would know that will happen when we ask parents to do the treatment, they can't always deliver the reinforcer when the child requests it, during that extinction challenge, having reinforced the appropriate alternative functional communication response actually increases the persistence of both that communication response and the destructive behavior that was previously reinforced in that context. And we believe that our multiple schedule functional communication treatment may help circumvent this problem by establishing the FCR in a stimulus context that is distinct from the ones in which destructive behavior historically produced reinforcement. And so one of the studies that we've done on this by Betts et al., published in JABA in 2013, we wanted to identify the necessary and sufficient components for the reinforcement schedule thinning. And we looked at, in study 1, the effects of the contingency correlated stimuli. How important is it to signal these periods where reinforcement is available and unavailable? And then in study 2, we evaluated the necessity of systematically and gradually fading the schedule of reinforcement. That is, the question was, if we bring the FCR, or the functional communication response, under very good discriminative control, can we make fairly rapid decreases in the rate of reinforcement and teach kids to tolerate long periods where reinforcement is unavailable rather quickly? And so prior to these studies, we conducted functional analyses to show that problem behavior was reinforced by social positive reinforcement for all participants. And we also conducted treatment evaluations using an ABA design to show that the FCT was an effective treatment. And this is just the functional analysis results. I won't go into detail on that. This shows an example of the initial treatment with functional communication training. You see in baseline high rates of destructive behavior. In FCT treatment, we have high rates of MANS, or the FCT response, low rates of problem behavior. We go back to baseline. We see problem behavior increase and appropriate behavior decrease. We go back to FCT, and again, high rates of the appropriate functional communication response and low rates of destructive behavior. This graph just shows that we produced basically the same pattern of results in all 4 participants. So in study 1, we wanted to figure out how important is it to signal these periods where reinforcement is available and when it's not available for the functional communication response. So we compared our multiple schedule, where the signals were available, with what we call as a mixed schedule, where we're alternating the reinforcement and extinction components in the very same manner, except we're not signaling when reinforcement is available and when it's not. And in these graphs, I'm not showing problem behavior because it remained at near 0 levels throughout the study. Sessions were 10 minutes in length. We had contingency specifying stimuli in the multiple schedule. We had 60 seconds of reinforcement alternated with 60 seconds of extinction. And all sessions started with the reinforcement interval, and all problem behavior was on extinction. So here's an example of one of the cases you see in this first phase. With the multiple schedule, we have high rates of requesting reinforcement when we signal it's available, and low rates or near 0 rates when we signal it's unavailable. We go to the mixed schedule, and we have high rates in the individuals requesting reinforcement both when it's available and when it's not available, because there are no signals. We go back to the multiple schedule and again get very good differentiation where the individual is requesting reinforcement only when we signal that it's available. And then finally end with the mixed schedule, where again we show high rates of reinforcement, requesting reinforcement both when the reinforcer is available and when it is unavailable. And basically this graph just shows that these same results were produced with all 4 participants. So the Betts study showed that inclusion of contingency correlated stimuli, or signals, was a necessary component of FCT schedule thinning. In our second study, in the Betts study, we wanted to look at whether or not gradual schedule fading was a necessary component. So we compared the rates of alternative and problem behavior when schedules were switched from a very rich schedule, meaning we gave reinforcement frequently, to a lean schedule where the schedule had been thinned, without going through a whole series of graduated fading steps. So again, in this analysis, problem behavior is not shown because it remained at near 0 levels throughout this analysis. And in this graph, what we see in baseline is the individuals are exposed to a multiple schedule with 60 seconds of reinforcement alternated with 60 seconds of extinction. and the individuals are only requesting reinforcement when we signal that it's available and not requesting reinforcement when it's unavailable. And then we move in the next treatment phase to the final schedule where reinforcement is available for 60 seconds and alternated with 240 seconds or 4 minutes. And what you see is we immediately get control of the functional communication response. That is, the individuals tolerated the jump from a very rich schedule to a very lean schedule without having to go through a whole number of graduated fading steps. And in this graph, with 2 other participants, what you see is we started out in baseline with a mixed schedule of 60 seconds of reinforcement alternated with 60 seconds of extinction. And as you can see, the individuals were requesting reinforcement both when it was available and when it was unavailable. And then we changed 2 things at once when we went to treatment. We went from that very rich schedule of 60 seconds of reinforcement and 60 seconds of extinction to our terminal schedule of 60 seconds of reinforcement alternated with 240 seconds or 4 minutes of extinction. And we introduced the signals. And as you can see with both individuals, where we introduced those signals and the terminal schedule, we immediately had the individual responding appropriately to the treatment and only requesting reinforcement when we signaled that it was available and not requesting reinforcement when we signaled that it was unavailable. And in addition, when we introduced that terminal schedule, we did not see an increase in problem behavior. So these data demonstrate that in some cases it's possible to rapidly transfer discriminative control of the functional communication response from a very rich schedule of reinforcement to a much more lean schedule. And this is possible at least with some individuals. Now it's important to note with these individuals, we provided contingency specifying rules. That is, we told them what was going to happen when one signal was present and when the other signal was present. And this probably facilitated rapid stimulus control, and additional research is needed to determine the exact conditions under which rapid schedule fading of this type is possible and when we need to go through a number of graduated steps. Now, in this next study, we wanted to determine whether multiple schedules and change schedules may facilitate rapid transfer of stimulus control in other ways than just from rich to lean schedules. For example, a long-standing problem in applied behavior analysis involves the transfer of treatment effects from the initial treatment context, such as a clinic, to other settings, such as a home or a classroom, or from the primary therapist or the first therapist to other interventionists. So in this study, we wanted to ask the question, do contingency correlated stimuli facilitate generalization across therapists and settings? And so we compared the rates of alternative and problem behavior when a multiple schedule was introduced across therapists or settings according to a multiple baseline design. So that in baseline, we had a mixed schedule in place, 60 seconds of reinforcement followed by alternated with 60 seconds of extinction. And then when we introduced the treatment, we immediately went to a multiple schedule with 60 seconds of reinforcement and 60 seconds of extinction. And again, as with the prior study, data on problem behavior is not shown because it remained at very low levels throughout the study. And what you see in this graph is in the top panel, which was conducted in the first room called room C, we have low rates of any functional communication responses when the mixed schedule is in place. We then introduced the multiple schedule, 60 seconds of reinforcement alternated with 60 seconds of signaled extinction. And what you see is kind of a learning curve where the individual learns to request reinforcement when we signal that it's available and learns to not request reinforcement when it's unavailable. Most importantly, we then were able to again make a jump to a big schedule, 60 seconds of reinforcement alternated with 300 seconds of extinction, and when we introduced that treatment into the subsequent contexts, into room A and then into room B, what you see is there is no learning curve. The treatment immediately transfers, and the individual in the very first session almost exclusively requests reinforcement when we signal that it's available, and refrains from requesting reinforcement when we signal that it is unavailable. So the conclusions from this study are that when a multiple FCT schedule was introduced in the first context, or with the first therapist, participants showed marked increases in the rates of the functional communication response in the presence of the discriminative stimulus, and relatively low rates in the absence of the discriminative stimulus or the extinction component. More importantly, when that multiple FCT intervention was introduced in the second and third contexts, or with the second and third therapists, treatment effects immediately transferred to these contexts and therapists. Now, transferring from one therapist to another in a treatment context such as our clinic is important, but even more important is how well do our treatments transfer to parents when we introduce them into the treatment context. And that's kind of a special case in that they present a unique challenge. That is, parents typically have had a long history of reinforcing problem or destructive behavior and have had little or no history of reinforcing the functional communication response because that was established in our clinic context. Thus, one issue that we have with primary caregivers is they may often function as discriminative stimuli that exert counter-therapeutic stimulus control. That is, when we introduce the parents, we often expect and often see that problem behavior comes back because of the history of reinforcement with the parent. So in this study, we conducted a functional analysis using our staff and the mother as the assessing therapist. And we conducted attention and demand baselines because the functional analysis indicated that the problem behavior was multiply controlled. And then we introduced treatment by first, in accordance with a multiple baseline design. We conducted the baselines with the mother, then introduced treatment with our therapist, and went through the treatment process until we had the functional communication response and problem behavior under good discriminative control. And then we transferred the treatment to the mother in accordance with a multiple baseline design to determine whether we could rapidly get transfer treatment effects from our therapists to the mother. And this is the results of the functional assessment, and I show this just to point out that the behavior was multiply controlled, and also that we had higher and more consistent rates of destructive behavior with the mother, particularly in the attention condition. Now, this is the graph where we introduce treatment according to the multiple baseline design, and what you see is in the first phase in the top panel, escape maintained destructive behavior was occurring at very high rates in baseline, and there was almost no compliance from Carrie. And then we introduced the treatment with our therapists until we got the desired treatment effect, and then reintroduced mom following that, and immediately got a nice increase to very high levels of appropriate communication responses, very high levels of compliance, and near zero levels of destructive behavior. We then replicated that finding in the bottom panel in the attention condition. So we did a multiple baseline across the two functions of the behavior: escape maintained problem behavior and attention maintained problem behavior. And this graph just shows what went on with our therapists in between the baseline and the treatment conditions we conducted with the mother. And what this shows is we had to go through multiple steps, and this individual was one of the kids that showed kind of a lot of requesting, even when we were signaling that the functional communication response was not going to produce reinforcement. And we went to the response restriction procedure, where the response card was out and available when reinforcement was available, and when we put the card away, reinforcement was unavailable. And that treatment worked very well for her, and that was the treatment that we ended up transferring to the mother in both the attention, both the escape and the attention conditions. So this is the first case where we've done this with parents, so these findings are fairly preliminary, but they did replicate the findings of the Fisher 2014 study showing that response restriction can prevent excessive functional communication responses when reinforcement for this response is unavailable. And this treatment also facilitated reinforcer schedule thinning. More importantly, when we introduced response restriction FCT at the terminal schedule of 60 seconds of reinforcement alternated with 240 seconds of extinction, and we introduced that with the mother, treatment effects immediately transferred to her in both the attention and the escape conditions. Now, finally, I want to talk about how effective multiple and chain schedules are for thinning the schedule of reinforcement for the functional communication response during FCT across a large cohort of patients with problem behavior. In this study, we used a combination of schedules. So in some cases, we used a multiple schedule of FCT. In some cases, we used response restriction. And in other cases, we used a chain schedule, and we used this primarily with behavior that's maintained by escape, where in a chain schedule, the individual has to complete a certain number of requests before the availability of escape comes by putting out the escape card. Now, there have been a couple of prior studies that looked at large cohorts of patients and the effectiveness of FCT. A study we published with Louis Hagopian as the lead author in 1998 analyzed 21 cases, and we found that FCT without extinction was relatively ineffective. FCT with extinction was highly effective in 11 of 25 cases, or about 44%. And the average reduction in problem behavior for functional communication with extinction was 68% over the full 25 applications. And when schedule thinning was attempted, functional communication with extinction, problem behavior worsened in 7 of the 12 cases where it was tried, or about 58% of the applications. We saw a worsening of problem behavior as we thinned the schedule. And also in the Hagopian et al. Study, we found that FCT, when punishment was added as a supplemental procedure, was highly effective in the vast majority of cases, about 90%. And when we did schedule thinning and had a punishment procedure in place, the treatment was effective in all 14 applications of schedule thinning. A more recent large study on FCT by Rooker et al. Found that functional communication plus extinction when supplemental reinforcement was included was highly effective. And they found that functional communication training plus punishment produced somewhat more variable results. And in this graph, we show the comparison of data from that early Hagopian study, the Rooker study, and our most recent study. This is the overall results that I'm going to present to you now in individual graphs so you can see each comparison more clearly. And so this shows the percentage of applications in which schedule thinning was accomplished. And what you see is in all 32 applications in our most recent study, we were able to thin the schedule of reinforcement compared to about 60% in the Rooker study and about 70% in the Hagopian study. And in the vast majority cases in our study and in the Rooker study, we were able to thin the schedule of reinforcement without having to add supplemental procedures, whereas in the Hagopian study, the supplemental procedures were necessary in most cases. Most importantly, the supplemental procedures that were used in our study and the more recent Rooker study, punishment was used rarely. In our study, only 2 of 32 applications was it necessary to add a punishment component. In the Rooker study, it was 5 of 32, whereas in the Hagopian study, punishment was added in the majority of cases, about 70%. In this graph, we show the percentage of applications reaching a 4-minute wait time, so that where the kids are waiting for at least 4 to 8 minutes at a time. And that was accomplished in the majority of our cases. And here's the the percentage of reduction from baseline. So what was the percentage of reductions? If baseline was at 5 per minute, a 90% reduction would be to reduce it to 0.5 per minute. And typically we're looking to reduce behavior by 80, 85, 90% or more. And this graph shows the overall, and you can see fairly consistent results across our multiple schedule and change schedule procedures, both when supplemental procedures were added and when they weren't, and much more variable responses in the Rooker study and the Hagopian study. And here it is broken down a little bit. So this is the final treatment. And what you see is in almost all cases, we achieved at least an 80% reduction in destructive behavior. In the majority, it was well over 90%. And you see more variable results for Rooker and also for the Hagopian study. And in this graph, you see the percentage reductions from baseline when without supplemental procedures. And as you can see, in the vast majority of cases, we were able to achieve that 80% or better reduction without having to add alternative reinforcement or adding punishment. And those conditions were added more often in the Rooker study and in the Hagopian study. And this final graph shows the percentage reduction when a punishment was added, and we only had to use a punishment procedure in two of the 32 cases, and in both cases produced 100% reduction in destructive behavior, so results more similar to the Hagopian et al. Study in terms of the effectiveness of when a punishment was added, but we only had to add a punishment component in just 2 of those 32 cases. So overall, what these data suggest is that destructive behavior reinforced by social consequences is highly responsive to treatment with FCT. Bringing the FCT response, or the FCR, under the stimulus control of multiple or chain schedules can facilitate the transfer of treatment effects to novel therapist settings and also potentially to parents. And finally, multiple and chain schedules can be used to increase the practicality of FCT and prevent or mitigate resurgence of problem behavior. And that concludes my presentation. Thank you so much for this opportunity to share this information on a very effective treatment.